Welcome to Your Body at Its Best with your host, Craig Jenkins. Brought to you by Performance Medicine.
Good Wednesday morning to each and every one of you in East Tennessee. It's Your Body at Its Best. Dr. Tom Rogers joins us once again, and he's getting all artistic on us, I think, today. Dr. Rogers, thyroid. You want to talk about that. We've gotten a lot of feedback about the thyroid. Why is that important?
Well, you know, my level of expertise is really on hormones and nutrition. And I have women every day that come to my office thinking they have a low thyroid, yet they've been told their thyroid is normal. Yet they have every symptom in the book of a low thyroid, like weight gain, hair loss, cold hands and feet, constipation, puffiness, fatigue, brain fog. And as doctors, really, we're taught to look at numbers a lot, which we should, but a lot of times those numbers don't tell the whole story.
Well, you've got a way by which to diagram that, if I'm not mistaken there, okay?
Well, I want to give you an example of how we work as physicians with laboratory results.
Okay.
We kind of base everything on a bell curve. Everybody knows what a bell curve is. Everything in this huge area here, we're going to say you're normal. If you're in the lower 2.5%, we're going to term you low. If you're in the upper 2.5%, we're going to term you high.
So anything inside of 2.5% is considered normal?
Anything inside this 96%
Wow.
is normal. The other thing you have to realize, this is all based on an average population, which is really a sick population. It's not a healthy population they even base these bell curves on. So it's a skewed curve anyway. So example, if you've been told that your thyroid or any other test was normal, and yet you're right here and you're having every symptom in the book, a lot of people won't treat you if you're there, only if you're here. So what I do as a physician is listen to the patient, number one. And if they're right here and having symptoms, of course I'm going to treat. You want them optimal. You don't really want them normal, you want them optimal.
And you can tell this by a blood test, right?
You can get by a blood test to give you a baseline and then listen to the patient.
Listening to the patient, which finally we've always said, finally a doctor you can talk to, and if you're on either one of these quote spectrums, you're going to initiate some sort of treatment.
Even if you're in here and you're having a lot of symptoms, there's treatments you can do.
PerformanceMedicine.net comes to the rescue once again. He's Dr. Tom Rogers. We will see you once again next week on Wednesday right here on CW20.